Today I'm going to talk about another acronym, ADHD. ADHD and persistent pain. ADHD stands for Attention Deficit Hyperactivity Disorder. And what I'll be talking about today is the adult version of that. So we call that adult ADHD. So you might wonder, well, okay, I know adult ADHD is a thing. A bunch of kids get ADHD and many of them grow out of it and don't have it anymore. And then a few people do as adults, and sometimes it can be useful for them in certain aspects of their lives, and other times it's not useful. But what has that really got to do with persistent pain? To answer that question, we've got to break down adult ADHD and actually say, what does that look like in the person who has that and appears in a pain clinic? And adult ADHD means that there is the presence of a deficit of attention, so that's inattention, and there is hyperactivity, that is the inability to perhaps sit still, or the inability to stop and think and plan. There can be different components to what the hyperactivity looks like. And what we know from studies is that it actually looks different between males and females, for example. So in a pain clinic, we'll often see a female patient who has adult ADHD. They often make the very best cleaners because their diligence is amazing. They are non-stop and they keep going and going because of their hyperactivity. But if they have an injury, that then becomes a problem because their hyperactivity stops them often from having the time to allow themselves to heal. And so they have ongoing pain symptoms. And in men, often what we see is that what brings them to the pain clinic is that they've had an injury on the building site or in the workshop, in the industrial area, where they've done something to their hand, had a hand injury or other type of injury. So it's the inattention that has actually caused them to have an injury and then brought them to the pain clinic. And the features of people who have adult ADHD, and many of these people are not actually diagnosed. They only get diagnosed when you actually start to talk to them about it. And you say, what were you like as a kid? Did you have trouble at school? Were you always fidgety? Were you in trouble with the teachers? What were your grades like? And you start asking them the symptoms, and you start to realise, yes, they had it as kids. They still have a number of these features as adults. And so one of the features of that is impatience. If you have hyperactivity, you don't often have the patience to pace yourself in your activities, so you keep flaring up your pain and giving yourself new bouts of pain rather than resolution of it. And you can look for the quick fix. You might think that taking an opioid will solve your problem, but in fact it doesn't. And that can be one of the traps that people with adult ADHD fall into in terms of looking for the quick fix for management of their condition. So we actually look at working with people, often helping them with some psychological techniques to manage their adult ADHD symptoms, and occasionally for people who've got particularly severe symptoms that are very problematic for them, then we can actually look at medication that can take the edge off these adult ADHD symptoms and allow better management of their pain condition. And even for some patients, just simply realising, that's what it is, gives them an understanding and ability to regulate themselves better. So sometimes just the diagnosis is sufficient to assist them. So again, pain specialists will look for all sorts of things in a pain clinic. They look at your mood, they look at your activity, they look at aspects of your history. And in addition, we also look for the features of adult ADHD.